स्टूडेंट्स को आवाज आ रही है मेरी? डॉक्टर इमरान आ रहा भैया? हेलो हेलो हेलो, any student listening? Hello. स्टूडेंट्स का कंफर्म तो क्या था? आवाज निकल रही है स्टूडेंट्स की।
आवाज अच्छी थी।
मुख्य लगता है जी।
मैं स्टूडेंट माइक कम बंद अंदर
जी।
ठीक।
Dr. Imran Arab here, Assistant Professor, Community Medicine Department. Today we will discuss acute respiratory infection. Before going to the disease and infection, first we have to understand that, what is the importance of respiratory system and how it functions. As you know that respiratory system is one of the vital systems of the human body. It mainly functions because we are taking in oxygen, and it's very essential system for the respiration of the human beings. Normally, what the system functions like that, we are inspiring oxygen and expiring carbon dioxide through lungs, and this system, respiratory system, starts from the nasopharynx and goes deep into the alveoli. And whatever the systems comes, whatever the parts come into the systems, they play a vital role, not only in the respiration of the human beings, but whenever any foreign body comes into contact or goes into the respiratory system, it plays a protective role through cuffing mechanism. When we are cuffing, we are pushing forcefully outside the foreign bodies which are going into the respiratory system. So whenever we are having a cough, it doesn't mean that we are having an not necessarily that human being might have any problem or any disease. Sometimes coughing, this reflex plays an important role by pushing foreign bodies out of the respiratory systems, because if anybody stuck in the respiratory system, it will be very hard for human being to survive. So it is the acute respiratory infection, and major causes of morbidity and mortality, especially in young children worldwide, and in young children like under 2 months, and infant, and under 5 years of age. Nearly 4 million children die every year due to the ARI worldwide. ARI accounts for 30 to 40%, means major hospital visits which are made by the children in hospital. ARI itself accounts for 30 to 40% of those visits. Means it is a major contributor of the hospital visits. Most young children worldwide have 4 to 8 episodes per year. of this infection. Means children might have respiratory infection from 4 to 8 times. Might be above that if he's getting more frequency. Incidence of acute respiratory infection is very high in developing countries as comparatively compared to the developed countries due to the hygiene and bad air and some pollution which is playing a crucial role, and dust and many such causes are present in developing countries. ARI comprises infection in any part of the respiratory systems, upper and lower. We will see which parts of the system they are coming in the upper system, upper respiratory system, and which parts are coming into the lower respiratory system. Classified, like I told you that there is acute upper respiratory infections and lower respiratory tract infections. If it's causes nasopharynx, like nasopharyngitis, tonsillitis, sinusitis, otitis media, these infections mostly occur in the upper respiratory tract. They involve the upper respiratory system, and there's acute infection of the upper respiratory tract. Acute lower respiratory infection of the epiglottis and laryngitis, laryngotracheal bronchitis, bronchiolitis. These all infections come to the category of the lower respiratory tract. Acute respiratory illness most common, especially in young children under 5 years of age, and major cause of the mortality and morbidity. Actually, in children, what happens, their immune system is not so strong, and they are prone to infections due to the cold and overcrowdedness, and they diet patterns. Like children like to eat ice creams and drink cold drinks and other such things, which play a main role in the initiation of the infection and transmission of the infection, propagation of the infection. Children, they are mostly affected by, as I told you already, that 30–40% of hospital visits alone, they are made by the acute respiratory infections. Can affect anywhere from nose to alveoli. Like I told you, that it starts from the nose, nasopharynx to the alveoli. So if it's involves the upper respiratory tract, like nose and nasopharynx, tonsils, it's upper respiratory infection. And in lower respiratory infections, bronchiolitis and pneumonia and other such bronchitis occurs. Can be classified into less developing countries. Measles and whooping cough are major cause of the respiratory infections. Unless in developing countries like Pakistan, other Bangladesh, and India, measles and whooping cough, they are also contributing in respiratory infection. Secondary infection occurs in such diseases because immunity is low, and opportunity infections, they are they initiate the process, and they initiate the disease process. Top 5 child killers with perinatal conditions, 20% contribute of the child related problems. Respiratory infection, second leading cause, is 18% of the child killers. Diarrheal disease, 17%. Vaccine preventable diseases, 15%. And malaria, 7%. And others, they are 23%. Means respiratory infection is second leading cause of the mortality in children, especially under 5 children. ARI are among the leading cause of death in children under 5 years, but diagnosis and attribution are difficult and uncertain. Sometimes we misdiagnose others because like golden measles and whooping cough. It occurs as a secondary infection. Sometimes simple flu is diagnosed as a upper respiratory infection, and sometimes it's misdiagnosis with association with other diseases. Another difficulty is that ARI are often associated with other life-threatening diseases such as measles. Means due to the presence of the measles, we are mostly concentrated on the deadly disease like measles and ARI and such disease. They are masked and they are left behind, and we don't concentrate on the presence of ARI if measles is present in the child. A study reports 62% of all deaths are attributable to ARI, but most of these were associated with measles. Pakistan aims to reduce child death from pneumonia, and Pakistan has worked later on. When we will discuss IMNCI, means integrated management of neonates and child illness. It's implemented in Pakistan, and with the help of WHO and WHO guidelines, Pakistan is working on decreasing respiratory infections, especially in children. So in Pakistan, the government has introduced WHO guidelines for acute respiratory infections. बेटा जिसको भी अगर कोई क्वेश्चन है सपोज तो काइंडली just for a while hold on. When I will complete my lecture in last 5 to 10 minutes, we will discuss and clear your queries regarding respiratory infections, whatever we will discuss today. So kindly just hold on for till we complete our lecture. So in Pakistan, the government has introduced WHO guidelines for acute respiratory infections, ARI nationwide, after training doctors and community health workers to use the technique. And we will later on discuss which type of trainings and why community is involved with doctors, why they felt importance to combine community to have integrated approach, not only related to doctors, but community involvement is very necessary. In Islamabad, use of these guidelines to improve the diagnosis and treatment of ARI among hospital outpatients under the age of 5 years has half pneumonia death rates among children admitted to hospital, reduced the inappropriate use of antibiotics, and led to the major savings in healthcare cost. Here, few things are mentioned that when this program was initiated, we are taking only example of the Islamabad, when these guidelines were introduced and implemented in Pakistan. What happened means sufficient proportion of the pneumonia deaths is reduced in hospitals, and reduced the inappropriate use of antibiotics. What here we witness, mostly we see that if any person has got flu or sign symptoms, which only might be a viral infection, viral mostly is completed or finished after completing its cycle. After 3 to 5 days, mostly viral infections, they are automatically finished. So what happens that mostly, especially general practitioners or the doctors which are running private clinics, and to earn the money and many things they are using inappropriate antibiotics and inappropriate use of the antibiotics. When a person has, if he have no any need of the antibiotics, but antibiotics are prescribed to those patients. If any infection is if it's recovered, if a patient goes into the recovery after a few days automatically without use of antibiotics or other medicines, why to give antibiotics to those patients? So mostly what we do, we misjudge and use rough use of antibiotics used on the patients to earn the money. So these medicines are not only used in the respiratory infections, but most antibiotics are also used in the diarrheal infections and other infections. In diarrhea, simple just to give ORS to the patients, but what we do, we give uh, flagyl mostly used to the patients, and other antibiotics like cephalosporin and cephalosporin and other supplemental medications are also prescribed to patients who can only be recovered by taking ORS. If antibiotics will not be used, other medications will not be prescribed to the patients, what will happen? The cost of the medicines and the cost burden on the patients will be reduced. So there's a need to have awareness and the use of these guidelines. And due to this reason, they have involved community, the doctors, so that community should be aware. They should know that if any child is having certain signs symptoms of a simple ARI or simple flu, so he only needs to have some home remedies. If home remedies are used, their child will be recovered within few days and without use of the antibiotics and other medications. So problem statement is that ARI is in young children responsible for 3.9 million deaths worldwide. Sometimes it's 43.9, sometimes it's 4.1, 4.5. There's annual statistics of the diseases. Bangladesh, India, Indonesia, and Nepal together account for 40% of the global mortality. Means Bangladesh, India, Indonesia, Nepal, these are considered as the developing countries, and 40% of the deaths only occur in these. Even Pakistan can also be included. 90% of ARI death is due to the pneumonia. Mostly death in respiratory infection occurs when involvement of alveoli occurs when pneumonia occurs in those children. Most of these children they died with the pneumonia. Most is bacterial in origin and deadly also are bacterial ones. Incidence of pneumonia in developed countries 3 to 4%. And in developing country, it is 20 to 30%. So in developed countries, there's a medical advancement and the early diagnosed and early managed such patients, and so that's why incidence of and even they can reduce the transmission to other patients. So incidence is significantly reduced in developed countries as compared to the developing countries. ARI in below 5 years child responsible for 30 to 50% of the hospital visits, like 40 to 50% as we already told. 20 to 40% of the hospital admissions, and it is leading cause of the deafness as a result of the otitis media. When ears are involved, middle ear. So the involvement of the system when occurs deafness in those patients might one of the end result. Epidemiological data mean like agent mostly respiratory infections occurs with the bacteria, and in bacteria there are Varicella disease and foreign bacterium diphtheria, Haemophilus influenza, Klebsiella pneumoniae, Staphylococcus pyogenes. In viral adenovirus, there are different viruses, enterovirus, influenza, ABC, measles, RSV, others are chlamydia type P, and Coxiella burnetii, mycoplasma. These are the agent factors. Agent factors means they cause the disease, and host factors which contribute to the disease means in which host, in which human beings there are high chances of the disease. There are high chances of the disease in small children, like under 2 months, under 1 year, like infant, and under 5 years. And fatality more common in young infant and who are malnourished, whose nutrition is compromised. In developing countries, fatality more due to the malnutrition and low birth weight babies. Upper respiratory infections more common in children and adults. Illness rate more common in younger children as compared to the adult ones. At third decade of life, there is a surge in infection due to cross infection from their children, which can be transmitted from one children to another. Women are more affected if they are exposed to small children, and these infections can also be can also occur in the immunocompromised children or patients. The patients are children who are immunocompromised, whose immune system is not so strong. They can't fight with the agents which are coming from outside into the body. So that's why the system is affected in the disease may occur in those patients. Risk factors are climate condition. If climate is polluted and the air is not a clean one, may trigger the initiation of the infection. Housing, if housing is bad, there is no any good hygiene or entry of the air into the houses, and stagnant air present in the house, and ventilation, there's no any proper condition for the ventilation. In those houses, there are high chances of the initiation transmission of the infection. In the industrialized countries with the pollution and chemicals, the transmission of the infection may occur, and it can also be increased overcrowding conditions, like already mentioned. When there is a poor nutrition in children, their immune system becomes weak. Due to the weak immune system, children, most young children, they are prone for the infection. Low birth weight babies, they are more prone to the infections because their systems are not so well, and their immune systems are also well developed to defend themselves. So in those children, there are high chances of the disease. Indoor smoke pollution can be a contributor, and maternal smoking is one of the contributors. Mode of transmission are airborne infections. It can be transmitted by air or droplet infection from one person to other person, either through coughing, sneezing, or such ways, and person to person. It can be direct or through bite. These transmission can these infection can be transmitted from one person to another, one child to another. So till this time we have discussed what is respiratory system, and what's the importance of it, and which are the causative agents and which conditions can trigger the infection. Now we are going to the programs and actions which are very necessary to break this chain. So in Pakistan, Pakistan is one of the UN member and WHO. So with the guidelines of the Pakistan, Pakistan has implemented IMNCI program. IMNCI is integrated approach. Means it is integrated management of neonate and childhood illness. It was initiated basically to reduce the burden from doctors and involve the community. If a community like mothers and other females and other persons, they are told that if any child is getting these signs and symptoms, then those parents need to rush to the hospital immediately. Or if there are some slight signs and symptoms and which can be cured or covered as the by use of the uh, home remedies, then they don't need to go to the doctors and hospitals, and with the care and with the hygiene, the children can be recovered immediately. So this is the approach which focuses on the doctors as well as community through systematic approach. So that now MNC has an integrated approach. Integrated means we are involving doctors as well as community and to child health that focuses on the well-being of the whole child. IMNCI aims to reduce death. Its aim is to reduce respiratory related death, especially pneumonia, which is one of the killer disease. Illness and disability means if a mother will care and they will maintain hygiene, give proper food, then the children will not be ill and what will happen? They will be healthy and the frequency of these diseases can be reduced. So, IMLCI aims to reduce death, illness, and disability, and to promote improved growth and development among children under 5 years. If the children will be healthy, they will go for the education. They will see quality education, and they can contribute from the country development and the family development. So it's very vital to involve the community with the doctors and IMNCI. IMNCI includes both preventive and curative elements. Preventive elements are those which means by use of these hygiene and socio-economic condition, improvement of the socio-economic condition and balanced diet, care, we can prevent the disease. And cure element is that if any child is getting any disease related to ARI, what actions should be taken? Those are included in the IMNs. Yeah. So, IMNs includes both preventive as well as curative elements that are implemented by families and communities as well as by the health facilities. Means here, why we call it integrated? Because we are involving doctors, health facilities, as well as communities. The study includes three main components: improving case management skills of healthcare staff, means to improve the skills of the healthcare staff, and second is improving overall health system. If we are improving the case management skills and health facilities by providing medications and other facilities at the health facility. And third one is by involving the family community in such health practices. So there are three components, three strategies which are involved in the IMNCI. Goal of the IMNCI is to standardize case management of sick newborns and children and focus on the most common cause of mortality, nutrition assessment and counseling for all sick infants and children, home care for newborns to promote exclusive breastfeeding. Means exclusive breastfeeding up to 6 months. No addition of any food till 6 months. Prevent hypothermia. Hypothermia is one of the danger signs. One of the risk factor to the children. So to prevent the hypothermia in the children and improve illness recognition in timely case. Improved illness recognition means a mother will be looking at the child. She will see that if her child is getting more ill, then she will rush to the hospital for immediate care and the cure of the child. If he is not having any such signs and symptoms, simple signs and symptoms can be treated and managed well by the mother through home remedies, care, and proper sanitation and the hygiene conditions. So here are three things mainly involve the IMNC approach. First is ask the mother, so what is the problem with the child, and second one is look at the child. What is the condition of the child when we are looking? Third one is classify. According to classify, we will manage the child. So it is very easy to differentiate into the ask, look, and classify. And after having these categories, it will be very easy to manage the every child whenever it comes to the high health facility. So if assess the child by asking for, ask means what is the age of the child, duration of cup, what is the duration of the cup, is from how many days child has cup. If child has cough, then is child able to drink? If child is not able to drink even once, then child is having a danger signs. It's very critical condition. So for that we need to hurry to the doctor and go for immediate management of their child. But if a child is able to drink, suppose his child stopped feeding, means sometimes it happens when a child is drinking any milk or anything, he vomits each and every drinking. If he vomits each and every drinking, then it's second danger sign in that child. It's like that one danger sign is that if a child is not able to drink. Second danger sign is that if child is able to drink but he vomits each and every drink. If he's ingesting or taking one from if child is drinking 5 or 10 times, and out of 5 times if he is vomiting 4 times but taking drink 1 time, then it's not a danger sign. There might be any other problem like nose of the child will block due to that he will have a difficulty in taking feeding. So there might be other problems which we need to sort out. Does child have fever? We need to ask from the mother. Had child suffered from any illness like measles? Is child excessively drowsy, lethargic, or unconscious? These are the danger signs. Did child have convulsions? Is another danger sign. Convulsions or fits. Having fits in the child is one of the danger signs. Is there irregular breathing? If a child is irregular breathing, we need to ask from the mother. In second phase, we can look by ourselves, but this first phase is only asked for. In look, we will see what actions need to be taken. So, is there any irregular breathing? or short period of not breathing means apnea is present. Normally, when a child is under 2 months, their apnea means short periods of the not breathing. It occurs normally under 2 months child. But if a child is above 2 months, then short period of not breathing apnea is not a regular one. It's not a good sign. Child turned blue. Child is something having something problem. That's why it has turned blue. Any history of tetanus. So first, if we are looking at the child, there we can look at and understand very easily. If we are looking at the child for general danger signs, here we can see ask and look. In ask, is the child able to drink or breastfeed? Second, so does the child vomit everything? And third is the child had convulsions or fits. And lift, see the child is lethargic or unconscious. This is one of the danger signs. Is the child convulsing? If a mother is saying that mother told that child has convulsion at the home, and but sometimes it's not possible that that child may be having fits at the hospital. But sometimes it happens that when you are taking history from the mother, child may be having fits at the hospital too. So we need to look at the child too. So this first portion is for the general danger signs. In second phase, we are clearly looking for the respiratory problem, as we already discussed. That in respiratory system, we need to ask for how long a child is having a cough or difficulty in breathing. If mother is telling something, then we need to look, listen, and feel. What we need to look and what we need to listen and what we need to feel. Look for the any chest in drying. Chest in drying means the respiratory muscle when they are goes between the abdomen and ribs means pasya under jana. It's called chest in drying. So we need to look for chest in drying. Look and listen for the stridor. Stridor is the sound which comes from the respiratory tract. It's inspiratory sound. It's listened when a child inspires, and wheezing. Wheezing is expiratory sound when a child expels air from the respiratory tract. It's a wheezing sound. So sound sometimes may occur with the block of the air. So even count the breath in 1 minute. Look, listen, and feel. In this portion, we are covering 4 things. First, count the breath. Second, look for the chest in drying. Third is look and listen for the stridor. Fourth one is the wheezing. For the counting of the breath, we should know what is the normal number of the breaths per minute. And it's different in different age group of the child. If a child is up to 2 months, the normal cutoff line is up to 59. If a child's breath is up to 59 per 1 minute, under 2 months of age, it's normal. But it's above 59, it's not normal. The child might be having a problem. But for up to 2 months, if a child is having breath per minute, suppose child is 65 breath per minute, then we need to recount again. If a child is having this problem under 2 months of age, we don't need to repeat counting of the breath when a child is above 2 months. But if a child is up to 2 months, his breath is irregular, means above normal counting, then we need to be counting. But it's specifically for the child is up to 2 months. So up to 2 months, the normal cutoff line is 59, and up to 12 months, the normal cutoff line is 49. Above 49 is it's 50. It's abnormal. It's fast breathing. If a child is from 2 months to 12 months, and from 12 months up to 5 years, the normal counting is normal cutoff line is 39. It should be 39 or more. But if it's above 39, 40, 45, 50, from 12 months up to 5 years, then it's a fast breathing. So counting of breathing is very important. Second is the chest. Look for the chest line. Look and see for strider, and look and see for the wheezing. These are the four which we do for the child. First ask. Second one is look. Third one is classify. Now, if we are having if child is having any problem, suppose if a child is any problem from the general danger signs, like if he is not able to drink or breastfeed, or if he is vomiting everything means everything. If he is drinking or breastfeeding one time and vomiting 4 times, it's not vomiting everything. It will be not a danger sign. So if a child is vomiting everything, it's a danger sign. Or child has convergence, it's a danger sign. If one of these present or these multiple presents may be a signs of the general danger signs. So it's called, like we just go into the red or pink color on the chart. This red and pink, it's divided into the signs, classify as and treatment. So first ask, second look, listen, feel, third classify. Classify, we need to go to the this colored chart. For colors, there are 3 colors: pink, yellow, and green. Pink is very serious condition. We need to hurry and go for the immediate management of that child. Yellow is moderate one, although it's not a hurry situation, but we need to take actions in the yellow too. Green is we don't need to worry, and we go for the home care remedies and such things. So in red or pink, which is in which occurs the presence of any general danger signs, which I already told. This classification is called severe pneumonia or very severe disease. Severe pneumonia or very severe disease. For treatment of this, we give first dose of the appropriate antibiotic for that condition and refer urgently to the hospital. Before going to the hospital, we need to give appropriate medication because this is a danger sign. It may take half an hour, 1 hour, 3 hours, 6 hours to reach the hospital. Till that time, we need to give some medicine to the child so that he may reach at the hospital and further management initially. It's a time critical condition. So in general danger signs, give proper medication and urgently refer to the hospital. This classification is called severe pneumonia or very severe disease. Second is pneumonia in which fast breathing. Fast breathing, I have told you already, the cutoff line for up to 2 months, cutoff line is 59. For 2 months to 12 months, it's cutoff line 49. And for 12 months to up to 5 years, cutoff line is 39. So above those in that group, there will be a pneumonia, fast breathing. In this condition, we will give antibiotic, means oral antibiotic for 3 days. If wheezing is present, we will give bronchodilator, soothe the throat and relieve the cough with safe remedy like soup and other such things. If coughing for more than 3 weeks or if having recurrent wheezing, refer for assessment of TB or asthma. If problem is not resolved after and having recurrent problems of wheezing and cough remains for at least 3 weeks, then we need to go for the TB and asthma. That might have the child might have a TB or asthma. Advise the mother when to return immediately. If we are giving medication to the child, antibiotic for 3 days, then we need to ask mother that you need to return to hospital after 3 days, so that we may look the condition and see any improvement in the child. If improvement does not occur, then we need to go for other options. Follow up in 2 days. Uh, in green sign, there's simple cough or cold. Means here there's no any signs of pneumonia or very severe disease. No signs of pneumonia means no fast breathing. No signs of very severe disease means in not presence of any general danger signs, or chest drying or strident calm child. So if absent of in these conditions means child is not having any major problem. He is simply having a cough or cold. In such conditions, simple soothe the throat and relieve the cough and give bronchodilator if wheezing. If coughing for more than 3 weeks, like as I already told you that the child might have TB or asthma, advise mother when to return immediately and follow after 5 days. If not improving, if their child is not improving, then follow for the mother. Their might their child might go into the pneumonia condition if he is not improving after such things. So this is a simple classification of assays in child IMNCI tool, which is used by doctors, but mothers also told. What mothers told? To see any chest in drying, उसकी पसली अंदर तो नहीं जा रही, कोई आवाज तो उसकी सांस में नहीं आ रही, स्पाइडर तो नहीं आ रहा, कोई ब्रीजिंग वो भी आवाज ये सांस में वो तो नहीं आ रही. ये सिंपल मदर भी सुन सकती है at house. Mother can listen at house, and she can decide either she need to go to the hospital or just go for the simple remedy of cough or cold or any general danger sign. If अगर माँ को पता होगा कि मेरा बच्चा कुछ भी दूध नहीं दे रहा या जो भी दूध लेता है वो सब निकाल देता है या उसको झटके मार रहा है, तो क्या होगा कि उसको खुद डिसीजन लेने में आसानी होगी. If he is told that child is not able to drink or vomits everything or having convulsions, so she can decide either the child needs to stay at home or go for the immediate hospitalization. So this is another classification which is under 2 months, but not necessary for you people because this does not occur in the ARI. But physical examination count the breathe in 1 minute. Fast breathing is when 60 or above under 2 months, 50 or above from 2 months to 12 months, and 40 or above from 12 months to up to 5 years, as I already told you on fast breathing to see the pneumonia. Look for chest drying. Look and listen for stridor. The sound produced while breathing in. Breathing means inspiring. When सांस अंदर ली जाती है तो breathing in means वो stridor होता है जो आवाज आए. अगर आवाज सांस लेने के दौरान ना आए तो वो stridor नहीं होगा, वो normal child होगा. और wheeze child wheeze जो आवाज है वो क्या है कि सांस बाहर निकालते हैं तब वो आवाज आती है. मीन्स ब्रीदिंग आउट जब होती है जो आवाज आए, और वीज नॉर्मली जो होती है वो अस्थमेटिक कंडीशन में होती है. वीज जो अस्थमेटिक पेशेंट्स होते हैं जिनको दमा होता है, नॉर्मली उन पेशेंट्स में वीज की आवाज ज्यादा आती है. abnormal sleepy and difficult to wake जो है वो lethargic condition है. उस कंडीशन में भी this is one of the danger signs which is not written in the chart, but this is one of the danger signs, and mother need to hurry to the hospital. Feel for fever or low temperature. Check for severe malnutrition. Look for cyanosis or bluishness of the child. और ये सारी मदर खुद ही देख सकती है at home and decide कर सकती है कि child को क्या करना चाहिए. Classification of illness में age child 2 months to 5 years में very severe disease है. or now next new classification, very severe disease and severe pneumonia, they come to the same classification, and pneumonia is second one, and no pneumonia means cough, simple presence of the cough and cold is third one. So signs means not able to drink, one of the danger sign. Convulsions, second danger sign. Abnormal slippery or difficult to wake, third danger sign. Stridor in calm child, severe malnutrition. These are these classification occur is a very severe disease. Treatment is refer urgent to the hospital, but give first dose to the child before referring to the hospital. Other I already told you. Severe pneumonia. Severe pneumonia is child respiratory is more than cutoff line. I already told. Chest syndrome, now chest syndrome is they are coming into the first one. Grunting is one of the sound which also occurs. Treatment refer urgently to the hospital, give first dose to of the antibiotics. और सिंपल ये तो नमूनिया थी फास्ट ब्रीथिंग जो है जिसमें एंटीबायोटिक्स दी जाती है एंड होम केयर दी जाती है और एंटीबायोटिक और होम उनको घर भेजा जाता है माँ को ये ट्रीटमेंट दिया और फॉलो अप आफ्टर 2 days किया जाता है. No pneumonia, cough and cold, if cough more than 30 days, need assessment for the TB and asthma. एंड अगर कोई कफ नहीं कोई इस तरह की सिचुएशन नहीं है तो सिंपल होम रेमेडीज इसके लिए होम केयर और कंडीशन इम्प्रूव होती जाएगी. उनको कहना है कि 3 से 5 दिन के बाद चक्कर लगाना है हॉस्पिटल. Classification up to 2 months is not important to discuss. Now control of the ARI. Control of the ARI by improving primary medical care service. Means that there should be presence of the doctors and medication and facilities at the hospital, and mother should be educated for the home care and counseling and the proper hygiene of the child, developing better method for the early detection, treatment, if possible prevention. Education of mother can be effective tool in reducing mortality and morbidity. Educating mother is very important tool to reduce the morbidity and mortality. Otherwise, it's not possible to reduce the disease in any country. Thank you so much. Just students, they are asked to just hold for a minute. सर जी थोड़ा इसका माइक ऑन कीजिए. क्वेश्चन और आंसर सेशंस के. Students, they are asked if any question need to ask from me, or they think that some things they could not understand well, or there's any need of repetition of anything. I'm here for 5 to 10 minutes. Yes, beta. Any question from any student regarding ARI? आवाज नहीं आ रही जी. स्टूडेंट आवाज न कीजिए.
पाण कोन का कहीं इन्हीं तो माइक जी तो ताकि आवाज अच्छी थी ना.
हाँ नहीं जो
कौन तो है
आड़े आए बिल्कुल आए. जी बेटा, any question from any student? Any question from any student? किसी स्टूडेंट को कोई बात समझ में ना आई हो? regarding ARI? ओके बेटा, फिर क्लोज कर दूं मैं लेक्चर? बस क्लोज कर दो। जी बेटा, आवाज नहीं आ रही है। आई एम नॉट लिसनिंग टू एनी स्टूडेंट। हेलो हेलो हेलो।
यस सर।
जी बेटा, कोई क्वेश्चन तो नहीं ना? थैंक यू। ओके बेटा, मैं क्लोज कर रहा हूँ अभी। थैंक यू।